If you'd like to kick those tobacco products to the curb in your life, well, the Green River District Health Department is here to help. Ethan Martin is a health educator. And of course, Merritt Bates Thomas is back with us, the Public Information Officer and friend of local lifestyles. Good to see you. Welcome, Ethan.
Thank you.
Glad to have you here. And this is an important ongoing problem for many folks in the area, not just smoking, but the use of tobacco. So, Ethan, what are you recommending, and what programs are available to people who are really ready to get in there and give it up?
Right. Well, so tobacco use still remains the leading cause of preventable disease and death in the United States. So, you know, these products are so addictive and so hard to quit. How do you do it? The health department has partnered with Quit Now Kentucky, which is the state tobacco quit line, and all states have these tobacco quit lines. Indiana, Quit Now Indiana, you know, so all states have that. But the health department has partnered with Quit Now Kentucky to offer free counseling. Anyone who calls and then enrolls in the program, and all you do is call 1-800-QUIT-NOW or text QUIT NOW to 333-888. But when you enroll in the program, you get 8 weeks of free confidential counseling, and you get 8 weeks of free nicotine replacement therapy. So nicotine patches, gum, and lozenges to help kind of wean you off of those nicotine products such as cigarettes, e-cigarettes, and things like that. And like I said, it's 100% free, 100% confidential. So.
Well, that's wonderful that you have that 8-week stretch, because as we all know, breaking a habit, you know, starting a habit or breaking a habit is really a challenge. That would get you in there and at least get you on the road for recovery, and having support is a big deal. Yes. So with Merritt, this is the month of Pride, and we understand that the friends in the LGBTQ plus community are using tobacco and other products. And let's talk about those social determinants and how it impacts that particular group.
Well, and for people hearing social determinants of health for the first time, it's the places where we are born, we live, learn, work, play, pray, and worship, and where we age. So it's basically our entire community. And when you look at those areas, it's all encompassing. It's the economic stability of a community, it's both the education and the healthcare access and quality that we consider. It's neighborhoods and that built environment. And then very, very important, it's that social aspect of it, that community context. So it's all about our relationships and making those types of things, all of these things, as positive as they can be, and all of us working collaboratively together to bring that about.
Well, yes, to all of that. And so if we're on the margin or in the margin or in a group that's more challenged, you know, what are the particular challenges for certain social groups?
Well, one of them being smoking and tobacco use. The fact is that the smoking rates have declined over the years, but the rates continue to remain high in subpopulations, including the LGBTQ plus population. You know, according to the CDC, 1 in 6 lesbian, gay, and bisexual adults are smoking cigarettes, compared to about 1 in 9 of their heterosexual straight peers. Same remains true with transgender individuals. Those smoking rates, people who identify as transgender, smoke at higher rates than their cisgender peers. And it's even sadder when you dive deeper into the data, and we see it with our youth. LGBTQ youth are using these products more than their straight peers as well.
Well, you know, if it's a stress reliever, and it is, but this is the opportunity to have those conversations and get some help, some very real help, by making that phone call and signing up for the program. Thank you both.
Thank you.
Great information. We'll be back, and we're going to the party right after this.